Who knew women had testosterone? We all do. Who knew men have estrogen? Some of us do. It's all a matter of ratio. This is a female testosterone, this is a male. So of that little bit, it drops down by the time you're 40 and a half. Right? And it keeps going down, 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 down. So that kind of goes with menopause. When does menopause begin? When you're good and ready, that's the answer. When the hot flushes come, that's the perimenopause. When the period has completely gone for 1 year, that's officially menopause. Average age of menopause, 51, which means it can start at 40, and it can, some women, it can only be menopause at 58. But you can see that's around the time testosterone goes. But it's not exactly coincided with menopause. It's got its own dynamic. So the bottom line is you've got two ways to make testosterone. There are a few others, but two main ones. In your ovary, in your adrenal gland, which is sitting on top of your kidney. Kidneys on both sides, on top, there's a little cap, that's the adrenal. It makes many hormones, adrenal. Biggest one is adrenaline, that's why it's called adrenal. Cortisol. But DHEA is its main one. So the DHEA comes out from both the ovary and the adrenal, goes through a couple of steps. Androstenedione, which is what Barry Bonds was taking, you know, the guy, the slugger, the baseball player, he was taking that one there, because what does it do? It converts and it becomes testosterone. Great. So, you may ask, well, why can't I just take DHEA over the counter in the States? Here it's a prescription, whatever. Because you don't know which way it's going to go. It's going to go down and become testosterone, and then it could stay testosterone, or it could convert into estradiol, the female hormone. So you've got a balance between male and female going on in every body, male and female bodies, and your ovaries are pushing out some and your adrenals are pushing out others. Ovaries also make estrogen and progesterone. Now, menopause happens, what happens to estrogen and progesterone? Gone, dead, alright? Ovaries die. Well, they don't fully die actually, they carry on doing things until you die, but until they cut out. But nonetheless, say there's no estrogen, progesterone, and now it stops making testosterone, mainly. Now it's the adrenals gland to take over. That's why it goes down, 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 but it doesn't go to zero, because your adrenals are still pushing it out. But the key is it going to stay as testosterone? Or is it going to become super testosterone, DHT, which is going to make your hair fall out, you know, male pattern baldness, some women get baldness. It's could make your face hairy. DHT, if you had a prostate, if you're a man, it could make it grow, that kind of thing. That's a good testosterone, good for sex or sex drive. DHT is great, but it has other things. Or is it going to convert to estrogen? And what makes it convert to estrogen? Enzymes and whatnot. Fat. The more fat you got in your body, the more the testosterone converts to estrogen. Which is why fat men have man boobs. Simple as that. They've got too much fat in their body, their testosterone is converting to estrogen, making them get boobs. Boobs. Okay, so that's the crux of the testosterone-estrogen conundrum.